The following video goes over the rehabilitation and recovery after breast surgery. Goals following breast surgery: decrease pain and swelling, improve skin and scar mobility, regain strength, range of motion, and endurance, restore normal arm function, and lower lifetime risk for lymphedema through education and exercise. General tips after breast surgery. For the first 2 weeks, limit lifting your surgical side arm to shoulder height. Avoid repetitive motions such as vacuuming. Avoid excessive reaching activities such as into the back of a dryer. For comfort, get in and out of bed on your non-surgical side. For the first 6 weeks, avoid pushing, pulling, or lifting anything over 10 pounds with your operative arm. Until cleared by your physician, avoid running or jumping activities. After these time periods, gradually reintroduce overhead, reaching, or lifting activities as tolerated, unless otherwise instructed by your physician or physical therapist. There are no limitations on the following activities: self-care activities such as washing your face, hair, and brushing your teeth, light housekeeping and meal preparation, and walking. Walking is a great exercise and can counter nausea and fatigue. You may go on walks to your tolerance, starting the day after surgery. Exercises to perform following breast surgery. These movements, exercises, and tips will encourage blood flow and prevent swelling in the post-surgical arm or arms.
The following are exercises you can perform if you have just had post-operative breast surgery. These exercises will help to improve circulation, range of motion, swelling, and breathing. Begin these exercises the day of your surgery and continue for the first 4 days. The goal is to promote and ensure good circulation of your arm and enhance healing and prevent swelling. The first are hand pumps. For this, you'll want to open and close your fist. Perform 4 times a day, 10 to 20 repetitions for each exercise. The next is wrist circles. Rotate the wrist up and down. The last circulation exercise are elbow bends. Again, perform 4 times a day, 10 to 20 repetitions. The following exercises are to improve range of motion. They should be started the day after your surgery, and the goal here is to maintain your shoulder range of motion in the initial post-op healing phase. You will want to perform these exercises 3 times a day, morning, midday, and evening. You'll start with 5 repetitions of each exercise and increase to 10 as you can tolerate. The first exercise is shoulder rolls. Roll your shoulders forward and backward. The next exercise are forward arm lifts to 90 degrees of shoulder flexion. Remember our precaution and do not raise the arm past that 90-degree mark. You'll also do these sideways, raising your arms out to the side to 90 degrees of shoulder flexion. The next exercise are shoulder pinches. You'll want to squeeze your shoulder blades together and back. The next are shoulder shrugs. Shrug your shoulders up and down. The next exercise are back crawls. With your hand behind your back, run your hand up your spine and back down. The last exercise are shoulder wings. Rotate the arms out and squeeze the shoulder blades together, then bring them back in. Again, You'll want to perform these exercises 3 times a day, morning, midday, and evening, starting with 5 reps of each exercise and increasing to 10 as you're able to tolerate. The following are some positions to help with swelling after breast surgery. After surgery, you may notice some swelling or puffiness in your upper arm, chest, and breast area on your surgical side. This is part of the normal healing process and will usually go away in 4 to 6 weeks. You may elevate your arm on a pillow while you are sitting or laying down to promote circulation. If you notice swelling in your hand or arm, raise your arm above the level of your heart while you sit or lay down. Perform hand and wrist motions 10 to 20 repetitions every 15 minutes. You may also lie down and elevate your arm on pillows above your heart for 45 minutes 2 times a day. This is a position you can go into to do that. Finding a comfortable sleeping position after breast surgery can be a challenge. For the first few days, you will want to keep the surgical side arm elevated on pillows or rolled blankets and lie on the opposite side of your back. The use of pillows and blankets to support the surgical side arm and decrease neck and shoulder strain is recommended. The following are breathing exercises for post-operative breast surgery. Deep breathing exercises are important for lung expansion and can help with pain control and relaxation. Practice deep breathing at least 5 times a day. The first is diaphragmatic and upper chest breathing exercises. Place one hand on your upper chest and one hand on your belly. Use your hand to feel the movement of your breath. Breathe in deeply and allow your upper chest to expand out as much as you can. You may feel some muscle stretching, and that is normal initially after surgery. Let the breath out slowly, relaxing your chest. Repeat this 4 to 5 times. Next, breathe in deeply and allow your belly to expand under your hand. This works your diaphragm muscle and fills your lower lungs. Your upper chest hand should not move very much, and you should feel the breath come into your belly. Let the breath out slowly and relax your belly. Repeat this 4 to 5 times. The same exercises can also be performed when laying down. Again, you'll have one hand on the chest and one hand on the belly, performing the same instructions as stated earlier. Again, repeat 4 to 5 times.
The following video goes over proper use of the incentive spirometer.
The following is an instructional video on how to use the incentive spirometer. You can use the incentive spirometer if one was issued to you in the hospital for generalized deep breathing. The incentive spirometer consists of a mouthpiece, numbers on the front indicating the volume inhaled, an arrow that allows you to set a goal volume, and a bead on the side indicating flow rate. These are directions on how to use your incentive spirometer. First, expand the tube by pulling both ends at the same time. Attach the tube to the tubing port. Slide the target to the volume level prescribed by your doctor or clinician. Exhale completely, and then close your lips tightly around the mouthpiece. Inhale slowly, keeping the flow rate guide between the arrows. When you can't inhale anymore, hold your breath for 6 seconds and exhale slowly and allow the volume indicator to return to the bottom of the column. Note the highest level the top of the volume indicator reached. Try to achieve your prescribed volume. You'll repeat these steps about 10 times, 5 times throughout the day. Keep a record of your progress. and chart throughout. As your ability to take a deeper breath improves, you can move your target arrow higher to create a larger goal. Again, try and keep the bead in between the arrows. When you're done using the incentive spirometer, store it in the following position to avoid dirtying the mouthpiece.
Healthy habits for patients at risk for lymphedema. What is the lymph system? The lymph system is like the body's storm drain system. It collects all the extra fluid and waste from the body tissues and brings it back to the bloodstream. It also functions as part of the immune system to trap harmful substances and bacteria. If a part of this system gets clogged or doesn't function well, it can increase your risk of infection and fluid can begin to back up in the limbs. Fluid backing up in the limbs is called lymphedema. During your surgery, if lymph nodes were removed, this can cause the lymph system to not function at its best. Lymph nodes cannot regrow, so this risk does not go away. If you are unsure if you are at risk for lymphedema, ask your doctor. Tips for lymphedema prevention. Embrace a healthy lifestyle. It is very important to achieve and maintain an optimal weight through a healthy diet and exercise to significantly lower your risk. When beginning an exercise program, start slowly and gradually build up the duration and intensity of your exercise routine. After exercises, take note of the at-risk area for changes in size, shape, texture, tissue, soreness, heaviness, or firmness. Maintain proper skin care. Keeping your skin in good condition is a key factor when dealing with lymphedema. Keep the at-risk area clean, dry, and well moisturized. Sunscreen is a must to protect exposed skin. And don't forget to use insect repellent. Use caution with razors and avoid nicks and skin irritation, especially in the areas of skin that may be numb. 4 triggers to avoid. Injury or trauma. Any injury to the skin can overload the lymph system and should be avoided. Wear gloves while doing activities like gardening and cleaning with chemicals. Avoid injections and blood draws on the surgical side. The next trigger is limb constriction. Avoid any tight band-like constricting around the at-risk limb, including use of automatic blood pressure cuffs or tight jewelry and rings. Another trigger is extreme temperatures. Avoid exposure to extreme cold or hot, like a sauna or hot tub, for extended periods of time. Avoid use of heat or ice directly over the skin, numbness, or areas that have received radiation treatments. The last trigger is prolonged inactivity. Keep moving and maintain an active lifestyle. Limiting movement in the at-risk limb can increase the risk of fluid accumulation. Movement of the muscles in the body assists with fluid circulation. Learn infection control. Infection in the at-risk area is a top concern due to impaired immune response. This may occur due to an injury to the skin. Look out for any of these signs of infection: rash, pain, itching, swelling, redness, fever, or flu-like symptoms. If any of these occur, contact your doctor immediately. If the at-risk area is punctured or heavily scratched, wash it with soap and water, apply topical antibiotics, and watch for any of the above signs of infection. Work with a certified lymphedema therapist. If you are at risk for lymphedema, a certified lymphedema therapist may be an excellent addition to your healthcare team. A certified lymphedema therapist is able to review your situation, personalize your risk factors for lymphedema, and serve as an important provider in care. See them regularly and report any changes in the at-risk area. Ask your therapist if compression garments for air travel and strenuous activity are right for you. If a compression garment is recommended, make sure it is properly fitted and that you know how to properly wear, care, and replace it. Thank you for watching. For any questions or concerns, contact your doctor or call the numbers provided.